We see an awful lot of shoulder issues, a lot of rotator cuff issues in our office. It can happen with athletes, doesn't have to be an athlete. A lot of times our patients will say, well, I've got a problem right here in the front, or I feel it down in this area. Those are areas that are actually referral areas. Sometimes the problem isn't just there, or isn't like maybe in the bicep, despite what a person feels. It can be coming from another area, particularly another area of the rotator cuff. So again, most importantly, if you want neck and shoulder issues to go away, or just shoulder issues, you got to make sure the nerve supply is proper. So we'd run some testing on that to make sure the nerve supply is proper there. We'd also run certain muscle tests. One of the muscles we would test would be this muscle here. We'll have the patient push down. I'm going to lift up, and we see if our patient's weak there. Let's just say that they were. It could very often mean that up under here is part of the rotator cuff. Subscapularis is one of the muscles. It's up under this area here. It may need some work. It may have some scar tissue on it. It can happen from sleeping on it. It can happen from falling on it. Certainly you can see it in certain athletes. So we may have to shorten that muscle and then have our patient lengthen it. This is kind of an active way to release it. But it helps break up scar tissue and fixation. Again, we're getting better nerve supply to it too as well with adjusting, which we're not demonstrating right now. But we see so many of those issues day in and day out. And again, a lot of times chronic shoulder stuff won't go away until you work on it. And you just can't chase the pain because the problem isn't always here. It can be referred from somewhere else. So anyway, stay tuned for more tips.